Parents, the first year of your child's life is the most important season of time they will ever experience. Their brain is going to double in size. They are forming over 1 million neural connections every single second. And there's so much that's changing that if we miss some crucial windows in that time frame, there is a lifelong impact. That is the foundation of everything else, right? The first year of life is the foundation or the architecture that the rest of their nervous system is built upon. Unfortunately, the way we handle that in that traditional pediatrician, traditional medical world is missing a lot, right? We're just looking at broad milestones. We're looking at general timeframes and making sure that we're roughly staying on track. The advice that parents are usually giving in that season of life, if their kid is struggling, it's some version of, well, let's wait and see until it gets bad enough to intervene or to treat it. Or don't worry, they'll just grow out of it eventually. Your fussy baby won't be that way forever. And I hate that advice. I hate it because, one, it doesn't help you in the moment, right? If you've got a kid that's struggling, you are at wit's end and you're hanging on by a thread and you need help then. But what's worse is it's not true, right? They don't grow out of those issues. They just grow into the next version of that problem because the foundation is disrupted if we don't address that, if we don't fix it early on. So let's think about this from a different framework. I want to understand why it is so important to look at that first 12 months of life. And then what are some of the things that can disrupt that? And then how do we get a kid back on track if they've experienced those things? I love this chart here. It's one of the slides we share at our Perfect Storm workshops. It's from the Harvard Center on the Developing Child. And what they map out here, you might not be able to see the exact details here from the video. Let me explain. 3 different aspects of development: sensory pathways like vision or hearing. Language development is the blue one. Then that red one is higher cognitive function. The peak amount of synapses or brain connections that are formed in those different areas of life are all within that first 12 months. And even something like cognitive function, right? We think of focus, emotional regulation. You think of those as way into the future, right? Maybe school age at the earliest or preschool, toddler range. That is started. That foundation of that happens in that first year. So when we're missing those things, it's going to show up at some point in the future, even if you don't see it yet, right? Because what should baby life be? Baby life should be simple. It should be eating, sleeping, pooping. That's really what it starts as, right? We get to a little bit down the road, we get to movement as well. But what we're looking for with babies is that we are latching well. And that latching process is complicated, right? There's so many different neurological mechanisms that have to be going well. Baby has to be in a relaxed, vibrant state. Their neuromuscular system needs to be regulated, right? There's a lot of cranial nerves, sensory pathways that are involved in a good breastfeeding or latching relationship. And so when a baby is feeding well, when they're latching and nursing efficiently, box is checked, right? We know that there's a good start to life. But then we also need to keep that food down, and then we need to move it on. That would be more so the reflux, the spitting up, the belly, gas pains that some kids will deal with, and then pooping, constipation. That is something that is way too common for newborns. Actually, just yesterday, going through scans of a little baby that started early on in their life, constipation and GI system was one of the biggest struggles, and mom was sharing how that is so far in the past and things are going so well. Actually, in the conversation that we were having, baby pooped and made a nice little mess of things. So constipation is a huge thing that we've got to address with kids because they should be eating, sleeping, pooping. Sleeping, it's normal for babies to wake up, right? They need mom and dad. They need to feed. So don't think, oh, if my kid's not sleeping through the night at 2 weeks, there's a problem. It's, are they inconsolable? Are they up for hours on end and you can't get them to regulate? You can't get them to calm down. Babies will communicate through crying, through waking up, through expressing their needs, but you should be able to meet those needs, right? That's a sign of a regulated kid. It's not one that never wakes up or never fusses. It's one that isn't inconsolable. They're not tense. They're not stiff. They're not arching. Even stuff like holding the head up right away at birth. It's a big red flag that baby is stiff and rigid and tense. They shouldn't be dealing with that. So that's what we should be dealing with. And then the next little milestone here is movement. We need to see kids thriving on their bellies, right? Enjoying tummy time, getting into that, hands and knees position, and then crawling, usually in that 7 to 10 month range. That is the most important neurological checkpoint. I hate that came off the milestone chart from the CDC and kind of the expected development a few years ago, because that is a huge missing piece of what kids needs, right? When they are not crawling properly, and when we see crawling, we mean not just moving, but we mean hands and knees, cross crawl pattern, right? Right hand, left leg, left hand, right or left arm, and then the right leg. You should be hands and knees moving in that proper motion because that shows that your brain is communicating left to right. So that is a huge thing that if we are missing, sure, it's not the end of the world for your baby to not move around perfectly when they're that age, but it's going to really show up with issues down the road, right? Emotional regulation, focus, sensory inputs are going to be more likely a struggle when your kid is skipping that foundational step. So why might those things go right? Why might those things go wrong, and how do kids end up in that spot? There's so many different factors, right? We call them the 3 T's within chiropractic: traumas, toxins, and thoughts. Physical, chemical, emotional stresses. But what they can amount to is some sneaky stuff that a lot of parents aren't looking for. The biggest one that we see people miss and nobody really points out or talks about is the birth process itself, right? That pregnancy into birth is a huge, huge conversation that we're having that I don't think is talked about enough. Pregnancy stress by itself can be a huge factor for families, right? We have more and more people that are struggling to conceive, which usually means that mom and dad's nervous system is in a state of stress. They're in a state of survival and fight or flight before even starting that pregnancy journey. Then let alone pregnancy itself might involve some unexpected surprises. Maybe there's an ultrasound that didn't go well and now we've got to monitor things, or maybe mom is feeling awful and they're on maybe some medications. They need to even get hospitalized. We've heard stories of recently. There's some sort of early on factors that are setting that nervous system pathway, both for mom and then therefore baby, in a state of stress. That tends to lead to then a birth process that has more intervention, that has more ups and downs and challenges with that too. Sometimes that means a full-blown named intervention, like you're getting induced, or you have an epidural, or you're having a C-section, forceps, vacuum extraction. But more often than even just those things, there's hands-on manipulation of that baby, right? There's pulling, turning, and twisting at that really sensitive head and neck area, and that makes a difference, right? That is having a huge impact on that developing nervous system. Coming back to what are the things that we see go wrong with babies early on in life, right? Latching, reflux, sleeping well, all of those neurological regulation mechanisms start up here, right? They start in that brainstem, upper neck area. So if we want to address these both baby challenges and get ahead of and resolve them in that moment, but also make sure that future development is heading in the right direction, we've got to start with the nervous system. We got to start with that foundation, right? If we don't address that, if we're in that state of fight or flight, yeah, maybe you make it out of that first year eventually, and you look back and be like, oh man, wow, we survived the colic, the reflux, constipation, the latching problems, or whatever it was. But then you go around the corner and your kid's got ear infections, or they've got a motor or a speech delay, or they're having some sensory challenges, or they're still not sleeping through the night years down the road, and that just keeps showing up in more significant ways. And it's not going to go away until we address the cause. So that's what we need to think about differently, guys. We need to realize that 1, that first year of life is so important, and 2, we need to do something about it if we have kids struggling, not just wait until it gets worse. I love that we have another way to assess besides just symptoms, right? The scans that we do at Thrive, the insight scans, are a huge part of seeing what's going on with babies. In fact, just that conversation I mentioned earlier of a little baby that was dealing with constipation issues, it's not anymore. We saw on the scans how there were big lower GI system findings in that start of care. They were doing great. They were all clear and thriving at this point. So the scans dictate the plans, and that's what drives care decisions to make sure that we're giving people the best care possible and they're getting that end result change that they need. So those scans are completely safe, whether you're a expecting mom or you're a tiny little newborn baby. Totally fine. There's no radiation. There's nothing going into the body. It's just a snapshot, just a picture, so to speak, of how that neurological pathway is functioning, because that's the starting point, right? Yes, the symptoms, yes, the downstream matters, but we got to start with function, and we got to start with the system that runs everything else, right? Your immune system, your gut, all those other things are neurological in basis. Parents, I hope that helps. Please do not just continue to suffer and deal with it and hope they grow out of it eventually. If you've got a baby that's struggling, trust your gut, trust your instinct, and let us be a part of that journey. Please comment here, reach out to the team if there's anything we can help with. Can't wait to meet you soon and help your family thrive.